Hello, my name is Christina Edmonds. I am a clinical instructor for Hugo Onondaga Bosie's LPN program. I developed a synthesis project to promote safe and efficient medication administration due to the amount of time it was taking to administer medications during the clinical day. Prior to implementing a change, the majority of residents on the unit were not receiving medications within 1 hour of their scheduled time, and the 8 a.m. med pass often did not end until almost noon most clinical days. Due to this, residents were put at increased harm for not receiving medications on time, including insulins and critical heart medications. This project promotes nursing leadership at the bedside by identifying an area which increases patient harm and implementing a change to improve the quality of care being provided by student practical nurses during clinical, along with bringing awareness to licensed nurses with the enthusiasm to want to continue to implement the change. Collaborators for this project were the Director of Nursing Program, Andrea Ruff, Director of Nursing at Loretto, Jolene Crehan, the Director of Education, Teresa Mosier, all who gave authorization and constructive feedback on this project and presentation, Unit LPNs, Sabrina Bellato and Casey Woodman, Student Practical Nurses, Rebecca St. Martin, Laurel Maurer, Mackenzie Wise, and Maureen Malkier, all who participated and gave insight and feedback on the study. The aim for this study is that by May 3, 2019, 100% of scheduled medications will be administered by the student practical nurses to the residents on the Loretto 7th floor long-term care unit within 1 hour of the scheduled time in an effort to prevent patient harm and improve patient satisfaction. After obtaining baseline data and performing observations, it was found that there were many disruptions throughout medication prep and administration. Research was done and found that large numbers of disruptions encountered while prepping and administering medications is linked to decreased efficiency and lengthened medication administration times. In order to decrease disruptions and promote efficiency, a multidimensional evidence-based practice was put into place, which incorporated the use of medication reduction zone sign to be placed at the medication station, and bright medication administration and progress lanyards were worn by the students during the prep and pass, as illustrated. In order to achieve the steps of the change, 3 PDSA cycles were completed. The first cycle included the team collaborating and planning to implement the medication reduction zone sign based on the evidence of Delaglio et al. The second step was actually hanging the sign and recording end times of the med pass and the number of residents who received their meds within 1 hour. Following each clinical day, results and disruptions were studied, which found the end times range from 10:03 to 11:30, and an average of 8 out of 21 residents received their meds within 1 hour of the scheduled time. Due to the lack of the progress towards the aim, another PDSA cycle was conducted with planning based on further evidence-based research, which recommended a multidimensional plan which led to adding bright lanyards to be worn during the med prep and pass, which stated medication administration in progress, do not disturb. During clinical days, these were worn in conjunction to hanging the sign, and results were recorded and studied. The results identified that 5 out of 21 residents received their medications within 1 hour of the scheduled time, and the end times range from 10:27 to 11:45, which did not indicate positive results towards the aim. After discussing with the team, it was found that some staff and students did not fully understand the project, which required additional education to be given. These people were re-educated on the significance and importance of decreasing the amount of disruptions, and results were recorded following these clinical days, which resulted in the average end time being 10:11 a.m., an average number of residents to receive their meds within 1 hour of their scheduled time to be 11, which, as seen on the 2 run charts, demonstrates a positive trend and improvement in results. The process of implementing the change required a multidisciplinary approach which engaged students, floor staff, the director of the program, and long-term care facility. Facilitators to the project were the support and enthusiasm from all disciplines. Barriers that were encountered were that there were rotating clinical groups with limited experience on the unit, med administration, and other skills, only being on the rotation for 4 days, unavoidable disruptions from residents, not being able to administer meds during meal times, which fell during med-pass times, and lanyards breaking. The impact that this change has brought to practice is the awareness to the facility and nursing program on the amount of interruptions encountered during medication administration, with the motivation to promote medication administration efficiency, quality, and safety. After adding all results to the two run charts and studying the results, it is found that the change did not meet the aim of the study, but, however, did demonstrate improvement following the 3 PDSA cycles. More research is needed to identify if this would be beneficial to licensed practical nurses practicing on the unit and its impact on preventing medication errors. However, it is recommended that all clinical groups and long-term care units implement these changes due to the large number of disruptions encountered during medication administration and the positive results that were identified from this study.